the ligament palpation can get a little tricky. So the big issues with the bone palpation are the medial and lateral epicondyles. Those are the two bumps on the side of your elbow. And then the olecranon process. When your elbow is extended, they form a line. When your elbow is flexed, they form a triangle. That's how they're pretty easy to find. So medial epicondyle of the humerus, lateral epicondyle of the humerus, olecranon process. Again, if I do it this way, medial epicondyle, olecranon process, lateral epicondyle. Am I good?
Yes.
Okay. The other bony prominence that's the more difficult one is the radial head. A lot of people will like to dig right through the supinator muscle to try to get it. I think that's the most uncomfortable way to palpate the radial head. I think your better bet is to go posteriorly. If you come just off the lateral epicondyle and you have the person pronate and supinate, you'll get the radial head. You'll feel it rotate. You can try to get it up here, but depending on the bulk of the forearm muscles, and there's a lot of blood vessels and nerves that run through your cubital fossa, that's a difficult palpation. It's uncomfortable. So I think you're better off getting it posteriorly. If I do it here, pronate, supinate, it's right there. So here's her lateral epicondyle. If I go distal to that, it's right there. Okay? If I have my finger on the radial head, I also have my finger on the annular ligament, because the annular ligament holds the radial head in place. Okay? And if I come off the radial head and just proximal, the space between the radial head and the lateral epicondyle is my lateral collateral ligament, also known as your radial collateral ligament. Okay? Any ligaments, and you'll find this as we get to the wrist and we get to the fingers and we get to the knee, any ligaments that are found on the sides of the joint are called collateral ligaments. And they're either medial and lateral, or they're named by their location, so ulnar collateral, radial collateral. And their job is to prevent varus and valgus stress. So in the case of the lateral collateral ligament, it's going to prevent varus stress. It doesn't let the elbow go that way. The medial collateral ligament prevents valgus stress. It doesn't let the elbow go that way. Are we okay with that? So palpation-wise, for the lateral collateral ligament, just find the lateral epicondyle of the humerus, slide distally, and the space between the lateral epicondyle and the radial head is the lateral collateral ligament. Okay? Also on this lateral side, before I jump back to the medial side, the lateral supracondylar ridge. So if I come up off of the lateral epicondyle, the edge of the humerus kind of curves up to become the shaft. That edge is the lateral supracondylar ridge. It's a super important muscle attachment for one of your wrist extensors.
It's the ulna, the flexor carpi ulnaris. Is your lateral supracondylar ridge?
It's an extensor.
Extensor
All your
carpi?
flexors over here. All your extensors
Which one?
over here.
What's it called? Extensor carpi radius longus.
Longus. It's the differentiation between the extensor carpi radius longus and brevis. All the rest of your extensors attach to the lateral or the lateral epicondyle, except the longus, because it's a little bit longer. It starts up a little higher. It attaches to the lateral supracondylar ridge. Helping you out with origins already. That one's a little bit different. Okay, the rest of the wrist extensors attach to the lateral epicondyle. All your wrist extensors attach here. Your wrist flexors attach here. Okay, here's my inappropriate PG-13, kind of how you remember that. MFers, medial flexors. That works for you.
It does.
Okay. The flexors are on the medial side. The extensors are on the lateral side. Okay? Make sure when you refer to the elbow, wrist, and hand that you think anatomical position, because if I do this, don't get confused. The extensors are still from the lateral epicondyle. Okay? So make sure you know where you're at when you're referencing medial and lateral in the forearm, wrist, and hand. Okay? So lateral supracondylar ridge, lateral epicondyle, radial head, lateral collateral ligament, also known as the radial collateral ligament, and radial head, and the annular ligament that surrounds the radial head. Everybody good on that side? On this side, you have a medial supracondylar ridge too. Be careful though, because your radial artery is right there, as it kind of comes this way. How when you were doing CPR on babies, and you put that brachial, did I say radial artery? Brachial artery, sorry, turns into your radial artery to kind of come this way. So some pretty significant soft tissue like ligament or blood vessels and nerves there. So just be careful if you're trying to get the medial supracondylar ridge. The brachialis is there. So from a muscle perspective, it's a good thing to palpate, but don't push too hard because you might cause someone's hand to go numb. Because you hit your medial epicondyle of the humerus, and if you go just posterior to that, there's this groove. What's in that groove?
Ulnar.
Your ulnar nerve. That is called your ulnar groove. It is the space between your medial epicondyle and your olecranon process, and it's where your ulnar nerve runs. It's your funny bone. When you hit your elbow and your hand tingles, that's what happens. You create a compression injury to your ulnar nerve. So that's a really important landmark to be careful of, because your ulnar nerve lies in your ulnar groove, which is created between your medial epicondyle and your olecranon process. Okay? And then coming just off the medial epicondyle is the medial collateral ligament. It's a definitely more significant ligament because you don't tend to have varus stress of your elbow, but it's pretty common to have valgus stress of your elbow. And so the medial collateral ligament, for those of you that follow sports, is the whole Tommy John surgery with baseball players. They injure their medial collateral ligaments. And if I think about it on a break, I will pull up for my doctoral case study thing that I had to do. I had a minor league baseball player who his medial collateral ligament calcified. And so I have the x-rays and the MRI of what it looks like. It's bone. It's ligament that turned to bone. And he had it reconstructed and rebuilt and all that. And so he had Tommy John surgery using his hamstring tendon to reconstruct his medial collateral ligament. It's pretty impressive. So some cool pictures of that. So I'll try to remember to get those out for you. But if you're on the medial epicondyle and you just come down, distally, it's a much thicker, broad band ligament.
There's going to be a space.
The space is a little harder to pick up because it's going from the medial epicondyle of the humerus to the coronoid process of the ulna, and that is deep. And so there's all those flexor tendons are in there too. So don't come too far because I'm going to get caught up in a lot of tendons. So if I just do this, that's all my flexor tendons. It's more this way. My flexor tendons are kind of coming this way. My pronator teres is there too. So if you just come right off of it, just above, I kind of use the ulnar groove as kind of my landmark, because if I come up from the ulnar groove, the edge of the ligament is palpable right there. And then you kind of lose it in all the flexor tendon stuff. But a lot of times with my baseball player that I rehabbed as well, when they have issues with their medial collateral ligament or their ulnar collateral ligament, they'll have ulnar nerve issues as well. So he not only had a medial lateral ligament reconstruction, but he had an ulnar nerve transposition. They move the nerve because it's in a bad place and it's going to get pinched or stretched or something's going to happen to it. And so they move it. They put it somewhere else. They take it out of that groove and they put it somewhere else. But that groove is a good landmark for you to come up more, and just find the ulnar groove and then come just a little bit anteriorly and you'll feel the ligament. But if I keep coming, now I'm into flexor tendon muscle. The ligament's under that. You can't get it any further than that. Okay, just give yourself a little ulnar nerve and tension injury right there. If you tap on your ulnar nerve, that's called a Tinel sign. That's a special test to see if you have. Tinel sign can happen all the way through anywhere in the body. You can tap on a nerve. The carpal tunnel one for the median nerve, it's still a Tinel sign. You just tap on it, and if you say, I get tingling in my ring and pinky fingers, that's ulnar nerve. Okay? questions? So